Today we're going to talk about a different type of treatment for lipedema, which is vein ablation. I don't perform those myself, but a lot of the questions that I get from patients that are seeing a vascular surgeon is, do I do my vein ablation before or do I do it after liposuction surgery? Stay tuned to find out. So, vein ablation. This is done for someone that has varicose veins or venous insufficiency. And there's really a couple different types of venous treatment. Those could be vein ablation, where they do it with a laser or some device inside the vein and kind of heat it to scar it down to close. Or they could also do phlebectomies, which is actually removing and stripping out the veins. Those are usually done through tiny incisions. Both of the treatments can be useful under the guidance of a vascular surgeon to treat leg swelling as well as pain related to venous swelling from veins in the legs. Patients with lipedema often have some degree of venous insufficiency, so this treatment can often be indicated either before or after. So how do we decide? Does a vein get treated before surgery or after surgery? Well, just like anything else, there's a lot of factors to take into account. I think if you ask a vascular surgeon, they usually want to treat it before the lipedema surgery. If you ask a lipedema surgeon, they typically want to treat the lipedema before the vascular surgery. So there's reasons for that. From my perspective, if a vascular surgeon is treating the veins, that will create some degree of scar tissue. So if I'm doing a lot of awake surgery, it's really necessary to not have any scar tissue because it makes the numbing process much more smooth. People tend to have less pain. Things get more uniformly numb when there's no scar tissue to go through, and it just feels a little bit less fibrotic when we're doing the liposuction surgery. So, my preference, if we don't have to do the venous surgery, is to leave that until we've already done the liposuction, and then it makes it harder for the vascular surgeon, which is totally okay with me. The only time where I think it's really, really beneficial to have venous ablation before any liposuction surgery is when you've got these big, ropey, varicose veins. And we've seen some photos, probably on our Instagram or on our website, of patients that have these really bad, very swollen, dilated veins. The reason that I prefer to have those treated beforehand is when we're doing the liposuction, small veins and things like that get torn. And in theory, the bigger ones don't, but if they did, those things can really let loose in the post-op period, and you could have some trouble with bleeding and get a hematoma, which is not fun to deal with, and it can really slow down the healing. So when I see someone that's got really large dilated varicose veins, my preference is to actually have the vascular surgeon treat those beforehand, and then that way it decreases the risk of bleeding by getting rid of some of those larger veins. One of the other things that I take into account when we're talking about venous ablation and do we do it before or after? Again, obviously, my preference is to do it after. But if I've got 6 months or 9 months where I'm scheduling out for surgery and I know a patient's not going to be able to get in, or if someone hasn't started their compression yet, they need to do that for 3 to 6 months, sometimes it makes sense to go to see a vascular surgeon. They can often get you in quicker for a venous treatment rather than just sitting around and waiting for 6 to 9 months for the schedule to open up or for you to finish your compression. So the nice thing about getting venous insufficiency treated is it can kind of be a way to do something while you're waiting to get lipedema surgery. So I think in that regard, if we know that there's going to be a 6 month delay in the timeline, it often makes sense to just go ahead and get treated. And then that way everything is done so that you can have the lipedema surgery and then you've already had the vein surgery and you're kind of done afterwards. I hope you found this video helpful. Please visit our YouTube page to watch any of our other videos here and here, or if you want to go to our website at www.elston.clinic, you can fill out an inquiry to come in and see us for a virtual consult. Thanks, have a good day.